Historically, flange sizing issues have almost always been related to overly large flanges, but there is an increasing trend recently of issues with smaller flanges. This issue is actually a little more nuanced and complicated than explaining overly large flanges or other flange sizing challenges. So let's dive in and look at why we're seeing this trend and what you need to know to understand why this latest and greatest flange sizing fad is not the answer to your problems. Poor sizing is a problem with all flanges, and the issues can be difficult to assess without careful clinical evaluation, as the issues of an overly small flange can actually mimic the same issues we see with an overly large flange to some degree. Recently, there have been a few presentations that have resulted in lactation professionals latching onto an idea and misunderstanding how to actually apply it. And now we're seeing an uptick in parents being sized too small. We're also seeing these ideas filter down to either brand new lactation consultants who are trying to present themselves as franchising experts, or even untrained professionals and other birth workers who are trying to break into this because they think that there's a money grab to be had. The biggest issue here is people who lack the proper clinical skills and training to handle a nuanced franchising but latch onto the sound bites from presentations without the ability to apply them in the real world. In franchising, there are no absolutes. Outliers absolutely exist. But what is done with an outlier does not generalize to everyone, and in this case, the specifics of how we handle outliers in franchising is being overly generalized and it's doing damage. So what do we see when overly small flanges are in use? We see pain, poor output, bruising, blisters, swelling, which can actually cause the appearance of increased elasticity in the tissue. And we'll get into why that happens more. Just remember the idea of ivy climbing a wall. We see a failure to respond to a particular pump, an inability to use a wearable pump, and persistent issues with flange alignment. It's also important to note that a skilled clinician doesn't even think about sizing exact or smaller with a standard pump without visualizing the tissue movement in a standard flange first. That means this idea of smaller flanges doesn't translate to wearable pumps, and those trying to use this method with wearables without extreme caution are just as much of a hazard to nipple health and your breastfeeding success as the hospital with their 30mm flanges. So let's take a look at what happens to the milk ducts with flanges that are too small. Inside the breast tissue is a series of clustered alveolar cells that are the milk-making tissue. This is where your milk is actually synthesized. When the nipple is stretched and stimulated, these cells are triggered by a release of oxytocin to expand and contract repeatedly, causing the milk to be forcibly pushed from the alveolar cells through a series of milk ducts that are essentially tubes for milk transport. Those go from the alveolar clusters and ultimately terminate at the end of the nipple, allowing milk to flow from the breast. That response to the milk from the oxytocin release is what we call the letdown reflex, and that's how the majority of your milk is actually transferred. When you're using a flange that is smaller than the base nipple size, the nipple will not fit into the tunnel to start with. Nipples are stretchy erectile tissue, so they will typically pull forward into the smaller flange size when suction is turned on. But when this happens, the milk ducts are going to be compressed within the flange. This is going to reduce the amount of space for milk to flow. The further the tissue is pulled into the flange, or the larger the discrepancy between the flange size and the nipple size, the more dramatic the compression of the milk ducts. This is no different than partially kinking a hose when spraying water. The smaller the area for the milk to come through, the more limited the flow is going to be. If you're looking at an exact size flange with a standard pump, this is less likely to be an issue, at least for the milk ducts. Now let's take a look at what happens to the nipple tissue. When nipple tissue is pulled into a small space, the tendency is for the tissue to stretch and climb. So again, the nipple is going to start outside of the flange tunnel in this example, and the suction is going to pull it forward, compressing the tissue. And stretchy erectile tissue is often going to respond with increased stretching in the flange. And what we often see is the immobilization of the base of the nipple in the tunnel, where the section of tissue is not responding with free movement. As the nipple is released with suction, the freely moving tip contracts, but that immobilized area doesn't. When suction is applied again, that nipple pulls forward, creating an increasingly large area of immobilized tissue. Like ivy on a wall, the nipple climbs the flange. And lubrication won't always help with this, as at some point the normal swelling of the tissue combined with the overly small flange is just a recipe for the tissue to be stuck. And it just repeats itself the whole cycle of the pump session. This can happen with exact sizing with a standard pump, but it's less likely to happen than with an overly small flange. What happens more often with exact sizing is the tissue fits, but swelling is extremely confined, and we see a bit more stretching than average, but no reduction in milk flow. Just no favorable response either, unless we're dealing with stretchy elastic tissue that was still being pulled too far into the flange with closer to a 2 millimeter bigger than base nipple size fit, which has been established as a data-driven sizing point in my practice. It's also important to note that the complete suction cycling we see with a standard pump results in more issues with exact sizing, whereas that same sizing can minimize issues with a constant suction pump's pulsing patterns. Different technology, different impact on the tissue, different flange sizing needed. If you're familiar with the Willow pumps, then you've probably heard the term mushroom nipple, referring to a phenomenon that was once essentially only seen with short inserts and the Willow's constant suction and elastic nipples. This trend of sizing small is actually pushing the mushroom nipple to happening with even standard sizing, but it presents a little bit differently. We have the same wedge effect of the nipple being too small in an opening, and sometimes we don't actually see the mushroom top effect. We just see a knob of tissue poking out of the back of the insert because there's not enough tissue there to even swell over. But sometimes we can see this swell over mushroom effect with more elastic tissue and shorter inserts, all because the nipple was placed in a flange that was too small, typically with lubrication to allow more movement in the restricted space. That lubrication wasn't being used for comfort, that lubrication was being used to address a poor flange fit. We aren't seeing this with standard pumps with traditional flanges as much for whatever reason. This is almost exclusively happening with wearable cups and pumps where the breast tissue is being compressed into the flange more than average, creating a perfect storm where combining with small flange sizing and no visual on the tissue. So why is this method of super small flange sizing so popular right now? Simple. We see these trends in nipple sizing and flange sizing come and go. People latch onto ideas when they're doing things they really probably shouldn't be doing without fully knowing what they need to know. We've seen the nipple socket measurement phase, the measure only the nipple height craze, the measure after nursing fad. The size up method is still alive and well despite the clear nipple damage this causes. And the super small flange sizing method is here for a bit, and I'm sure we'll see it again in the future. The reality is flange sizing isn't simple, and not even all professionals have the right skill set to help you. So as long as moms are out there struggling, the first charismatic person to come along and offer them a promise of relief, moms are going to try it. It's just how it has worked. So right now, what they're promising is, I'm going to size you smaller, and that's what you actually need. So for now, we're just going to add a new indicator of flange sizing issues to the self checklist. So when you're evaluating your flange sizing to see if it's working, you want to measure, is it comfortable? Is the tissue moving freely in the tunnel? Touching is okay. Stuck to the side with no movement is bad, especially in a standard flange. Minimal areola pulled into the tunnel. The nipple fits in the flange tunnel opening at the start without compression. It empties the breast well after adjusting to it, and there's no pain or damage to the nipple areola. So if you meet all these criteria, your pumps are working well, you're comfortable, there's no pain, there's no damage at all, you're okay. We may be able to optimize things and get you more output or faster emptying, but this is not causing any damage. And as always, if you're not sure if your flanges fit right or you're having any struggles with breastfeeding, book a consultation today for the skilled support your nipples deserve. Happy pumping!